Okay, looks like we're live. Thank you very much for joining me this evening. You'll notice my wonderful conversational partner, Christy, is not here with me this evening. She was not able to make it, and so you're going to have to deal with just me. I will try and stay on task and speak about what we're talking about. I do have the comments enabled on the Facebook chat, and I have it up where I can see it this time, so please feel free to type in. I'll try and address comments as they come in. If I don't get to yours, I'll get to you after the live broadcast. If you're just joining us on Apple Podcasts or Google Podcasts or elsewhere and you're getting the audio-only version, you're going to get 99% of what we talk about just fine. But if you want to join us for the Facebook live stream, you can do that. We have those throughout the week here and there. And just sign up for our mailing list. You can find that at lasertherapyinstitute.org. So today, to jump straight in, we're going to be talking about nerve repair post-surgery, and this is one that is really important if you've gone through any significant trauma and have dealt with an actual nerve problem that is surgical in nature. And what I mean by that is that there are many injuries like motor vehicle collisions that have enough force that nerves can actually be severed. Or completely taken off of the muscle they're supposed to innervate. When that happens, you end up with a significant diminishing or complete absence of firing in the muscle. And this is very, very common, like I mentioned, in motor vehicle accidents, but also in motorcycle accidents for sure. So we're going to talk about how to use light and lasers to get some of that nerve function back. Now, this is, again, a severe injury that has required a surgical repair. Now we're going to try and use light to get back to that point. Before I go any further, my name is Jason Rountree. I'm a chiropractor and certified medical laser safety officer. Thanks for joining me this evening. I'm also the founder of LTI, which is a network of laser therapy experts across the nation and Australia. I invite you to find out if there is a clinic near you by going to lasertherapyinstitute.org. But we do this podcast every week so that we can try and spread the good word of laser and light therapy out there. It's becoming more and more popular. If you're just now hearing about light and laser therapies, do understand we're not talking about laser surgery in this case. We're talking about using light in a non-invasive, completely comfortable way to stimulate the body's biology. The new term for this is called photobiomodulation. We still say laser therapy because our clinics all use lasers. However, there are many light sources that can produce very, very good effects as long as a clinician knows what they're doing with them. So let's talk about nerve injuries. So many nerve injuries that are really significant, where you have a nerve that is actually pulled away from the muscle that it's supposed to connect to or becomes just completely severed, many of those nerve injuries will need a nerve transplant. And many times this comes from somewhere on the patient. So today we're talking about a brachial plexus injury. Now the brachial plexus is a network of nerves that come off the neck and then down through the shoulder and then out to the hand. With a really heavy impact onto the shoulder, that can, in a lot of cases, just tear some of those nerves away from where they're supposed to be. A very common one is where the musculocutaneous nerve gets pulled away from the bicep, and so the patient loses the ability to flex the elbow. They can't bring the arm up. That, in most cases, is going to be a surgical issue that has to be then repaired. So let me give you the title of the study. It's called Photobiomodulation, or Laser Therapy, after neurotization, which is also called an Oberlin procedure, in the brachial plexus injury, a randomized controlled trial. This came out in 2020, just a couple years ago, in photobiomodulation, photomedicine, and laser surgery. And essentially what these researchers did is take patients who had had this surgery and then apply real laser to some of them and fake laser to others, and then compare how they did. Now, they say that these brachial plexus injuries can result from high-energy trauma to the upper extremity and the neck, like we just talked about. Usually with motor vehicle accidents, about 70% involving motorcycle accidents. Now, the surgeries to repair this have gotten a lot better over the years. However, they say that any treatment modality that can potentially accelerate nerve regeneration would be extremely beneficial for patients who have undergone neurotization. Now, let me give you a little visual on this. I think it'll help. So if you're able to see that picture, what we're looking at there is different nerves that connect to different sections of both the arm and the leg. And we're going to be looking specifically at the arm, of course, today, but even with a lower extremity problem, really this all still applies. So what the researchers are doing is they're taking a nerve from one portion of the arm and they're simply redirecting it to the bicep in order to get that bicep to fire again. So they're taking one, and it's actually just a portion of the ulnar nerve, and they're crossing it over to the bicep. So that then the patient, as that nerve starts to function, can regain use of the bicep, because that's a pretty important motion. You know, if you go through life without being able to bring that elbow up, it's everything from drinking a cup of coffee to performing your job to typing. I mean, lots and lots of things can become difficult. So they take about 10% of the ulnar nerve and then they redirect that to the bicep. And it's not an immediate fix. The patient doesn't wake up from surgery and just go, all right, now I can move this. Instead, it takes months for that nerve to really figure out where it's at, and then for the body to start using that nerve pathway. The nerve actually has to regenerate in that pathway in order for the motion to start up in that bicep again. When it first starts up, it's very, very weak, right? It's like a dimmer switch. So you very gradually, that dimmer switch gets turned brighter, which means the muscle slowly gets more and more strong. It may never recover full strength, but in a lot of cases, people get a lot of really good use of the arm back. So these researchers wanted to go ahead and see, is there a way to speed that process up, to speed up the strength return, the nerve regeneration process post-surgery. So they had one group that got laser and one group that got the fake laser, right? So that's a sham. That's a sham-controlled trial, placebo-controlled trial. And what they did is they started doing laser in one spot right on the surgical scar, which is right about here on the bicep. And so they would do that, and they did it 5 days a week for 2 weeks, so a total of 10 sessions. And they used this laser. It was a 808 nanometer laser with 50 milliwatts of power, and they delivered 4 joules per centimeter squared. Now, if that sounds like Greek to you, that's okay. Just understand this is very, very low power. Again, we're not burning or cutting anything. It's actually a very, very small dose, and again, delivered just to one spot at the top of that surgical site. So 5 days in a row for 2 weeks straight, and then they just stopped. They did that with the fake laser, of course not turned on, and they did it with the real laser, turned on. And then they started to compare and say, okay, where are we at this point? Who is improving the fastest? Did the laser make a difference? What they found is that once they got to the 3-month mark post-operatively, 100% of the patients who had the real laser had achieved elbow flexion, this motion, of at least grade 1 or better. Only 28% of patients in the control group who got the fake laser were at that level. So the mean muscle power was also significantly higher in the laser group. So not only did everyone who got laser therapy after this procedure recover the actual elbow motion, flexion, they also were all stronger than those who did not get that laser therapy or had the sham laser therapy. And I have a graph here I want to show you, actually a couple of graphs, both at the 2-month and the 1-month mark. See if I can get this arranged correctly. So the big bar there is the patients who received light therapy, and then the other bar, the small bar, is those who are getting the sham therapy. So 14.3% of the sham, the control group, were showing good signs of reinnervation at the 2-month mark, whereas 57% of those who had gotten the laser therapy were showing signs of reinnervation. Again, that is muscle strength, muscle activity. Now, by the time they got to the 3-month mark, like I just read to you, 100%, every single patient who had laser was at least showing some sign of muscle activity in that elbow, whereas only 28.6% of those who got the fake laser were getting that same level of at least grade 1 strength in that bicep. So that's a pretty strong indication that light therapy should help speed things up when it comes to nerve recovery. Even with something traumatic like a nerve transplant, where they have to physically take a nerve, cut piece of it off, transplant over, tie it into a different muscle. this is a significant procedure. So to see such a big difference between those who got the real laser and those who got the fake laser is a pretty good indication that light therapy does a great job at helping nerves to regenerate. Now, this is a very small study, right? There was only a handful of patients, about 15 patients that went through this trial. Still, that's a pretty significant difference between the two. So right there, there's a couple of takeaways. One, laser therapy does work. To what degree, we're not entirely sure yet, but it's pretty clear, it's pretty obvious that it does work. Number two, almost any laser or photobiomodulation therapy device could benefit somebody who has gone through a nerve surgery and is looking to recover quicker. Now, not just any, but many different light therapy devices could meet the same exact parameters that these researchers met. Even an at-home unit that could meet these parameters. Again, 808 nanometer laser, so anywhere in the 800 to 820, 830 would probably be just fine. That's the color of the light, the infrared color. It's about 800 to 830 nanometers. And then very low power. We said 50 milliwatts being delivered to a very small 1 centimeter spot size. And that is enough to see a positive difference. Now, in many cases, what we see as clinicians is that applying more light to a larger area can give even better results. So whether that would show that in this case or not, I don't know. But just on a day-to-day basis, I will tell you that usually lighting up more of the tissues than just one spot can be good. But still, if you don't have a Laser Therapy Institute clinic near you, you're looking for some way to use light therapy post-injury for a nerve injury like this, certainly a home use unit could be good. And LED units are quite inexpensive, really, in comparison to lasers. If you're looking for more information on that, feel free to send us an email. info@lasertherapyinstitute.org. We'll be happy to try and help you out as best we can. You can also look on there for additional resources for patients. You can find our podcasts on the website. You can find our podcasts on Apple Podcast or Google Podcasts, Pandora, pretty much anywhere you get your podcasts. You can also find us on YouTube. Thanks very much for tuning in tonight. Hopefully this was helpful. Again, any questions, send them to us on email. Thanks.